And once you do that, I'll look at that. Consent. Oh, you don't even have to press the button. All right. Hi, good afternoon. My name is Alex Campbell. I work for Oregon Housing and Community Services with the Disaster Recovery and Resilience team. Thanks for coming today. We've got about a 25 minute presentation. I've got several of my colleagues here with us, and also Jamie McLeod Skinner from Department of Human Services. So we want to spend the bulk of the time on your questions and answers. We'll see. Hopefully I can preempt, answer a few of them before you get to them, but I'm going to start with just a quick recap. I'll begin with a recap of what the HARP program is, describe again the funding opportunity that we've asked you all to consider. We're going to talk a bit about the reporting and compliance requirements, and then turn to you all for questions. So I've got some slides, so you got something to look at other than my face. So there's the agenda. And so launching into what the HARP program is. So the HARP program, right, replaces primary residences. That could be completing a rebuild or purchasing a new manufactured home. Phase one will have is going to be open to low and moderate income households. We do not have a reimbursement component in the first phase, but subject to funding eligibility and working that out with HUD, we are hoping to add it. And that's one of the nuances that I want to be sure to say over and over again, is that we're going to have an application when we open the HARP phase one portal. It's going to have two components. It's going to have a survey eligibility and then the application itself. And we're hoping to drive as many people as possible through the front end of that to let us know what their remaining needs are and how they're hoping ReOregon can help them. And then we'll only ask the folks who appear to be eligible for phase one to go through the significant application process. So again, we can, it's the primarily to address folks who are lost their primary residence. So homeowners of their primary residence lost in the 2020 Labor Day fires. Typically, we're going to be sizing the replacement project to the size of what the home was that they lost and the type of home that they lost. We will have, and folks who have a program, a repair program. So it's got really two audiences there. One would be, there was a wind event as well. We know that very few homes were damaged by the fires. I mean, virtually every home that was touched by the fires was destroyed. But there were some that just suffered damage. There were some that suffered damage from the wind event. And there are some who still have hazard trees that may not have been fully addressed. So we can address those under the repair program. And then we also know that folks who have, as part of their recovery, bought a new home, new to them, right? And that may have been another stick-built home, or may have been a used manufactured home, that there are health and safety issues with some of the homes that folks purchase. So the HARP program is also designed to help them. So the threshold being, if you're not fully recovered, and we define fully recovered as having a new home that you own that's safe and healthy to live in, this program is there to help you. And then, as I said, potentially in future phases, folks who have physically recovered but were financially really stretched by the efforts that they made to recover. That potentially we could address that in some sense in future phases. There is also an accessory dwelling unit program. Won't spend a lot of time right now on that, but it's a way for us to fund some more affordable rental housing as part of this program. So we provided you all with two different scopes of work. One is for the outreach and engagement, i.e. leading up to and post-launch, as we continue to reach out to as many survivors as we can to get them in the door, looking at the program, coming in and applying. And then a second scope is actually to help with that process. So it is assisting folks literally with the application process itself. So that, I think, most commonly that will look like your organization having either office hours that are drop-in office hours, or perhaps doing it by appointment, having a physical location where a survivor could come in, bring whatever documentation they've got with them, and you'd be sitting down at a computer with them. Either they're typing or one of your staff members is typing, and they're going through the steps of literally completing the application. Once they hit apply, obviously, very likely they'll hit save and come back in, and may have to do a couple different sessions before they get through all the windows and are able to hit apply. But once they hit apply, that application will go to a program management vendor that we are bringing on board to process. So do the formal eligibility review, do the award determination, duplication of benefits. So anyway, we're looking for help on the ground with the work that needs to happen in community. So the outreach, making sure folks are aware, and getting the applications done. So saying a little bit more about that outreach and engagement support, we want to make sure that every survivor who's eligible for phase one, right? That's probably the highest priority, making sure every survivor that's eligible for phase one is aware. We also, as I said, are really interested in making sure that we understand the needs of folks who need our assistance who aren't eligible for phase one. We want to reach everybody, but we know that some survivors have additional barriers. So we're interested in understanding from you, the folks who have these additional barriers that you've already been working with, what's been successful, and are asking you to make some additional specific effort to helping folks who have challenges with literacy, challenges with getting to a physical location, challenges with internet access or computer access, period. So I'll just say this one more time because it's really important to us. We want everybody who is eligible to apply. And we think a really important way to do that is to focus additional work on reaching out to populations that maybe have English language barriers, have not been able to access other programs because of citizenship or residency requirements. So that's what we're hoping for, and I think it's also worth adding, I'm optimistic that we will be able to get in touch with everybody who already has been connected to disaster case management services. We also know that there are folks out there that have not yet. Mary, are there multiple people still coming in, or is this the same warning? Are you?
There are a few, but I've got them.
Awesome, thank you. So those individuals, right, who were concerned about applying for FEMA for a variety of reasons, or mistrust government, whether that's because they're concerned about government or they're concerned about their own status in this country. We know that those are the hardest folks to reach. So to the extent that you have ideas and thoughts about how we bring those survivors in, that's really important and really useful, and we want to prioritize that. So we have been talking to Oregon Department of Human Services preliminarily. We're working on a little MOU about how to structure this. But ODHS has a call center, and they've offered to do some outbound calls to some, or potentially, a large portion of the households that are in that database, depending upon how we can slice and dice that population. Obviously, we don't want to bother people that we are 100% confident don't need our program, but we think that it's better to err on the side of reaching out to a lot of folks. So what we're talking to DHS about would be them using that call center and calling a very large number of survivors. So that's been just evolving discussions, and if it was more settled, we would have obviously included that in our original notice of funding availability. I don't think this means that it doesn't make any sense for you all to include in your plans to do some similar phone outreach to populations that are in your data set. But just to be aware that this effort is going to be going on as well, and it includes we're gonna have a sort of belt and suspenders approach to release of information and access to Vision Link information. We know there are things like insurance settlements that may already have been uploaded to Vision Link. It's maybe a year ago, and the survivor may not have immediate access to them. We would like to be able to just bring that directly over from Vision Link. So we are going to be asking for some additional releases of information. The final note here is more related to the intake support, as we're figuring out the details on where and how the intake support happens. DHS has expressed a willingness to make some of the physical locations that they've funded available for that kind of work. So turning to that piece, that other scope, the intake support. So again, it's the same target population, but this is obviously sort of a higher level of intensity of work. Folks would need a higher degree of training to help somebody through the intake process. We also, once we've got the engagement, right, we've got the ability to kind of drive folks to locations, and/or we'll have their contact information so we can continue, or you all can continue scheduling and working with them directly. When I'm talking around a little bit is, as we said in the original announcement, we're anticipating a fairly large number of organizations to help us with the outreach and engagement. Our belief is having more hands doing that work gives us the best chance of spreading the message as far and wide as possible. With the application and intake support, the balance shifts a little bit more to the capability and training, and having folks who are really well familiar with the intake process to provide a really higher level of support. So we're thinking about a smaller number of organizations that we would fund more robustly for this application and intake support. And happy to talk more about that in the Q&A. So in terms of reporting, we certainly require monthly reports. I was just, Adina Haslip and I, who's our contracting and compliance lead, we're just looking at this language today. The quarterly, annual, and ad hoc maybe is probably overkill there. We're, as part of our follow-up from this meeting today, when we send out the recording, we're going to send you all some slightly updated scope information that I think is just a little cleaner and a little bit better written, we hope. But anyway, the reporting is a essential component of both scopes. We will be able to provide. We expect to be collecting that reporting through an online web form. So we hope that we can make that reasonably painless for you as far as the reporting. But obviously, in order to report accurately, that's going to require data tracking systems and you all to be tracking your work in a way that matches those reporting requirements. In terms of financial reporting, we again will be requiring monthly reports, expenditure relative to the approved budget, any financial correspondence. So that would be any invoices that direct costs that we would be reimbursing to you all. We would be comparing that to the agreed budget. Anybody using these funds would be subject to audit by us or out by our funders. So certainly would want you to be aware of that, going into the process. The compliance has multiple steps. So prior to the award, we're going to make sure we need you to be in the SAM system. We will be providing a questionnaire for you all so we can do a capacity and risk assessment. That's one of our requirements from HUD. Before we engage a subrecipient, we have to conduct that assessment. So once we've done that and we've made sure that the budget makes sense to you, makes sense to us, we can go into an award and contracting process. That as part of this process, we're going to be sharing with you and talking about your internal financial controls. We don't want you to get in any trouble with these federal funds, and so we definitely will provide support to you there. But it's not an insubstantial amount of work to make sure that your accounting systems, and financial control policies are all in place. So post award, there is quite a bit of guidelines and requirements as far as how you carry out your activities. A lot of that has to do with record keeping and clear record keeping of your activities under the grant. The monitoring is monitoring by us, and can include on-site, desk file monitoring, what looks, a lot like an audit. And then at closeout will be there's work again there, making sure that all the files are complete and that we've got all the records so we can adequately close out the project. Before I turn to timeline, because that's an area that I am far from expert in, I want to give Adina an opportunity to amend or supplement anything I said, anything important that I may have.
You did great. There was nothing missing.
Okay. Thanks, Adina. Well, thanks for the slides. I just read them. Hopefully I didn't read them. I try not to do that. All right. So just a couple more slides for us, and then we'll turn to your questions. That's the screen I want to share. So final screen or second to final screen, we're doing the Q&A today. Later this week, we will send out the recording of this session. We will include some questions and answers that we've already heard. We will include questions and answers provided today. We will provide answers to the questions that we're not able to answer today. We're going to provide updated scopes. And the last thing that I want to be sure to mention is we're still having discussions internally on the compensation basis, particularly for the intake and application support. If you looked at the draft budget, there's the opportunity or the place for you all to define a cost per application. There are pluses and minuses, obviously, to compensating providers like you all on an hourly basis for your work versus providing payments for getting a complete application into the system. If we can't give you really clear directions within the next couple days on where we're headed with that, we will extend the due date for those intake support surveys. We want to give you every opportunity to understand what we want before you're spending too much time working on that. So you should expect some clarification on that point from us. So, the survey responses are due March 27th. I'm feeling pretty confident that's a good date for the outreach and engagement. Potentially, as I said, we may need to let that slip a little bit, depending upon whether we can give you really clear instructions very soon on how we want to see the budgets for the intake support. We've given ourselves a little bit of time to do the review and reach back out to you all if we've got questions, with the goal of May 1 having folks under contract for both scopes. So outreach and engagement, that would allow you all to, really be starting that engagement, that outreach work on or near May 1 for those organizations that would be assisting with intake support. That gives us, based on our current scheduling, we expect about a month to do the training. You may have an additional staff person that you want to bring on. We're going to be engaging those folks as we're testing the application portal. That would give us, like I said, a month to gear up before we're expecting that the application portal to begin. Mary, I imagine you've been watching the chat, so why don't I let you feed questions from there, and why don't we run through the questions in the chat first?
We don't have any.
Oh, I saw a dot in the chat and I didn't even look. Great. Yeah. Well, I'm sure I did not address all the questions. So thanks for coming and let us have it.
All right.
Yeah, Devin, please.
Did you find it?
Yeah, I'm just trying to unmute you.
Hey, Alex, one of the concerns, and it could just be a rumor as well.
Was she?
Is,
sorry, Devin. Amy, could you mute? Oh, you did. Thank you. Go ahead, Devin.
One of the things we've heard is for like primary residents, when you were talking about size replacement for the homes, is we've heard that replacement value will be about 185 a square foot. Is that because in the McKenzie Valley right now on the low end, you're looking at 250 to 260 a square to replace, and the range goes all the way up to 400 a square.
So, $400 a square foot construction cost, right, is, I mean, I don't care where you are, that's high-end construction,
That correct, correct.
right? So we're not funding high-end construction. I mean, you know that, but, where we heard some feedback from folks recently on that. We've got somebody on our team whose brother's a contract in the Santiam. We've gone back and looked at RS means and done some checking again. We feel like 150, I'm forgetting what's in our guidelines right now, whether it's 150 or 155. We don't feel like that's far out. So if you have reputable contractors that you'd like to put us in touch with that could explain to us why they can't do construction for any less than 225 a square foot in the Blue River area, we'd certainly be interested to talk to.
So Alex, you said less than 225?
Well, I mean, so right now we've got it at 155.
155.
And it is, and just to be clear, that it's not that the construction that we're funding can't be more than 155 a square foot. We're setting a benefit cap based on the square footage of what the prior home was, right? So if they're partially completed, sorry, does that make sense to you? Right? It's not that any individual construction has to fit within that amount. It's that the overall project can't be more than that amount, or our contribution to their recovery can't be more than that amount compared to their square footage to start with. So I guess, and the other thing to say is we will have their exception processes, but if we're off base, just generally, let's get it fixed ASAP.
All right, sounds good. Thank you, Alex.
Okay, we do have some questions in the chat. And we'll start with the first one. I'm assuming is the application complete probably for this process to apply? And
Yeah.
if so, can we see the application before March 27th?
This is,
yeah, go
I
ahead.
was asking that question, and I
Yeah.
actually meant the application for the HARP program.
Okay.
Yeah, the application that the participants would be completing. You know, we do have a sort of dummy version of it. You know, it's not built in the system of record. So I think likely we could share that with you soon. I don't know if it would necessarily be before or after March 27th. And my only hesitation about like what we've already built is that we got sign off from DOJ on our system of record contractor yesterday. So we're finally going to be able to really dig in with them. And they've got a huge amount of experience with specifically CDBG DR. So we're going to be sharing with them what we've lined out thus far. I'm hopeful that they may have some ideas for us on ways that we could make it easier for applicants. Whether we get through that process by March 27 or not, I'm not sure. We are very close to having a required documentation list that we could share with you. You know, that's not something that would be changing much in the future. So that's something that we can and will provide to y'all soon. Yeah, I don't see any reason why that can be available to you before the 27th. And in fact, I mean, we could share the dummy version of what we've done for the application pretty soon with you all too, with the caveat that the final product, may look significantly different, but it would give you a good idea of the substance.
Yeah.
And yes, the application will be translated into Spanish, and then further translation would be on request. And we will be providing collateral. So yes, we will be providing all those things that you're listing there. And yes. And Jose, I'm not totally sure I got your question there. Oh, you're referring to the construction cap. Honestly, I'm not sure. We do know anecdotally, and it makes sense, right? That there is a construction bid premium to going up the canyon, or the canyons. So I can't answer that immediately. And it looks like somebody's got their hand raised. Kathy.
Hey, Alex, this is
Hey.
Kathy from One a Day. I just have a question. So when I was looking over the application, and you're supposed to submit like an estimate of per navigation, what a cost would be. So are we able to are we able to send it off with that portion blank if we don't really have the information about possibly how long or how in depth an application would be? Or could it also be like on a per application that you guys like reimburse per application X number of dollars, or
So there,
like that?
thank you. There are a couple, I hear a couple of different questions there, whether you're asking them or not, I'll address them all. So, one, I think we should just commit to get the version of the application out to you all. So you can see, I don't think it's going to change enough that it would significantly impact your level of effort. There is a lot. And I'm somewhat disheartened and saddened to say that, because I'm afraid that it is going to be a challenging process for folks. The reality, I think, is our best way to manage that is managing expectations. The reality is we need this information because of the structure of the HUD program. And one of my colleagues suggested the analogy that I think is pretty accurate. I think people should think about this similarly to buying a home, right? I mean, there's a lot of paperwork when you're buying a home. We're talking about, potentially that same kind of amount of money changing hands. So we will commit to get to you all soon. I don't see any reason why we couldn't include in our communication this week a PDF of what we've worked up thus far. And then the second, your question also touches on, are we, if we're asking you to give us a per application cost. So I'm gonna give you a really clear clarification on whether that's how we want to do this. If I can't give you a really clear clarification on that in the next day or two, Kathy, we're going to push out that survey deadline. So you all, can think about it with full information. Was there another question there that I didn't get to?
The only other one was if it would be a reimbursement per application. If so, so you say it's $300. Well, I'm just going to make this up, right?
Yeah, right.
Like you say it's $300 in applications for every application, and then the nonprofit or whoever just bills OHCS per invoices OHCS for 15 applications or something like that.
Yeah.
Is that a possibility?
Yes, yes, that is. And then, sorry, and I should have been more clear. That's exactly what we are talking about. And if there are opinions about that on this call, Kathy, yours and others, they're certainly welcome. I mean, we see some benefits to doing doing it that way, reimbursing you all per application, and we could do a higher amount when you're assisting with an application outside of normal business hours. We could do a higher amount when, for instance, if you actually have to go to somebody's home, who's got disability and transportation issues. So there are some benefits to doing it that way. I think it's probably simpler for you all for us to just do it on an hourly basis, but though that's exactly what we're struggling with what makes most sense. So if there is feedback on that, from you all, we're definitely all ears. And if you reflect on that after this meeting over the next 24 hours, please shoot me an email.
We have a couple of questions about intake support and open communication channels with people reviewing the applications. What will that look like?
Yeah. So our thought would be to give you all view rights into the system of record, because we know that applicants are going to follow up with you all with questions probably as much or maybe more than they want to call a 1-800 sort of call center number. And to be clear, our thought would be that even if we could pay you sort of per application for the application support, that we do believe that there's likely work post application, and very likely you all would bill us on an hourly basis for that additional work.
Okay, and then also on that, is there an opportunity to appeal application decisions?
Yeah, absolutely. So there's there is we are required to offer an appeals process, and I don't have the exact details on that right now, but yeah, I think that's one of the things that we'd want you all, as sort of an impartial voice to be helping advise survivors on when and if it makes sense for them to file formal appeals.
Okay. And then quickly after that, is there going to be a call center number for applicants on their status update?
Yep, absolutely.
Okay.
So they will have they'll have the ability to, yes, the program management vendor will have a call center. I think one of the details that we have not yet worked out is exactly which questions we'd encourage applicants to take to the call center versus which questions we'd encourage applicants to contact you. All that with the caveat knowing they're going to call who they want to, and we don't want to, play the game of the question, or the answer to the question, but tell them to call somebody else anyway. So, but there will be a call center that the program management vendor will be staffing.
Okay, and then I think one more on application stuff, but will the intake partners have access to VisionLink documents that maybe the applicants do not have access to anymore?
So I guess one answer to that question is I don't manage VisionLink, and so I don't know and wouldn't answer anything about what access you currently have to VisionLink. But the part of the reason for our engagement with DHS would be to get potentially you and our program management vendor access to VisionLink to pull documents from there. Jamie, anything you want to add?
Yeah, thanks for the question. And as Alex mentioned before, we're still working on some of the details of the arrangements for DHS, but DHS would create a separate what's called incident in VisionLink, and then when the DHS call center went through the initial calls, we'd need to get the release of information (ROI), and then would create this separate incident. So the organizational partners, those who are participating formally in the contract and contracting with OHCS would have access to that VisionLink incident. So it would not be access to all VisionLink, but that the VisionLink incident for this project. And then also the amount of information that was available would depend on whether or not an ROI was secured. And so part of this partnership would also DHS would seek to get an ROI for release of information so that people can fully engage in the project. But if they didn't offer that, there were barriers, that would also be part of that partnership of working with community partners to contact if there were communication barriers with households had been impacted, and then also to try to secure those. And we're looking at some of those options, how to do it, potentially even telephonically, or how we could get some of that ROI, the ROI established so that you would essentially have access to more information on those individuals, but they have to offer the information. It would not just be a straight turnover, handing over to VisionLink, just because there are, information protection requirements on DHS that we'd have to honor. So part of this early process and part of the conversation that we're having right now, or the two state agencies are having right now, is how we can have a process to ideally get you all access to as much information as possible so you can help facilitate the application process. Did that answer your question?
Yes, thank you very much.
Thanks, Jimmy. I just don't want to miss, Jose, your point about the construction cap. Yeah, I mean, I think you could look at it both ways, that it's inequitable to provide a higher cap because that's funding a higher cost project. You could also look at what's important, is the higher price tag, what you look at for equity, or the amount of construction that they get, the key factor for equity. But like I said, we at this point have done some additional, so we based that cap off, there are industry standard data sources, RS Means and others. We've heard some concerns. We've gone back and done some more research. The research that we've done doesn't make us feel like we're way off base. We do continue to hear anecdotal statements that we are, but so welcome the opportunity to talk to contractors or others to understand if we are off base.
And then we'll have a question from Nelda in the chat, and then Kathy has their hand raised, but we'll start with Nelda. Will you please talk a little bit about how we will help survivors after the application and award?
Yeah, so that's two different phases, right? So there's between application and award. So there are an application may appear to be complete, right? But when the program management vendor is doing the review of documents, they may find a document that doesn't actually have the information that they need. So there would be a question back to the applicant to, provide a substitute document or provide a clarification. And if the applicant needed, the support of the program partner to address something like that, that's an example. Another example would be post-award. At that point, folks will be working with contractors. We have construction advisory services that are going to be available through the program management vendor, but your knowledge on the ground of contractors, of permitting processes, of any number of things, right, could be really important to getting the survivor through the execution of their project. So we know that you all have relationships with these folks, and they're going to run into all kinds of challenges. I think, well, clearly we know we do need to line out at a higher level of detail when and if which problems we want the program management vendor to work on versus which problems we want you to work on. But again, like I was saying earlier, regardless of what we decide about that, we think it's important for you all to be available to help folks just understand the process. And it may be as simple as saying, look, this is a question you really need to go to the program management vendor and helping them understand the language, right? They may see the problem as X, Y, or Z, but technically in our language that we're using, it is G, and that is a question for the program management vendor.
Okay, and then Kathy has their hand raised, and then we'll go to Nicole's question.
So, and another question I have is with the folks that you're contracting with to process the applications. Last time when we did ORAP applications, the issue was everything was being sent out via email, and a lot of times it wasn't language appropriate. So we would go to a family who had didn't have very little knowledge of how to even use email, and then they were getting lists of what was missing from their application, so they couldn't respond. So that's kind of one concern I have. And another one is that there was always this requirement of a 3-way call that the applicant had to be on hand, even though we had all their information about them, and it was a simple question that they could have been answered. And that was honestly a big barrier for us getting through, because it took a long time to get through to the call centers anyway.
Right.
And then once we got through to a call center, it had a simple question like, I don't remember. Look, I'm just gonna make something up. What months do you have that their back rent is for, or something like that, something that simple. No, the person had to be in the space. And a lot of times, because our office hours are after regular office hours or after 8 to 5, then it was even more challenging to get response because they would stop at like 6 or something like that. So I'm just, could that be a requirement of the call centers to have expanded hours, weekends, and up until like 8 o'clock or 8 p.m. because that's when the majority of our folks can come in to actually get our assistance so that we can call them just because of the language barriers.
Great, thanks, Kathy. Those are great questions and good flags for us. Appreciate it. And Nicole, the historical knowledge of the time length from application to determination. Yeah, so we actually do have some sort of expected required timeframes built into the RFP actually for the program management vendor. So we can pull those and include those in our follow-up communication to you all.
Okay, thank you.
And as we're talking about timelines, I did, we got a question from Melissa today at the sit about timelines, and I think this is consistent with the email that I sent out. She was asking what kind of length of time should she be assuming for budgeting purposes, and the first answer is most importantly, just let us know what you're assuming. But my suggestion would be for the outreach and engagement, probably six months makes sense. You know, we're hoping to get that started in May. We think it is very likely that we do have a couple different phases of application. So, and by the time that we're through like the second phase, right, that the bulk of that outreach work has been worked through, and it would be just a matter of communicating with folks if and when a future, third phase opened. And in terms of the intake support, I think 18 months is probably a good time period. You know, we know it's going to take significant amount of time to approve these projects, and then it's going to take a significant amount of time to get these projects done. So. As you all are thinking of other questions, if other questions occur to you before the end of business today, or even before noon tomorrow, and you want to send them my email, that would be great, because then we could include our responses and send them out to everybody. So we definitely don't want this to be the end of communication and clarifications, but as many questions as we could get soon. That way we can share the responses with everybody. Kathy's asking about advocacy services available to families that have issues with the contracts, legalese when working with contractors. Yes. So yes, we the program management vendor, one of the capabilities that that we have included in the RFP is construction management advisory services. And we also, within the action plan, sorry, I don't know how bad that background's for you all, also have a program to provide legal services to survivors. We have it better thought out and figured out and thought through how we are providing the construction management services at this point than the legal services. But absolutely, we know that we're going to need to support survivors through all kinds of messy situations. Capacity building supports. Yeah, for sure. And I mean, there, so there are several levels of that, right? One, we can and are obligated to provide you all technical assistance on the compliance and financial reporting pieces of using these funds, and absolutely will do so. We're going to be talking to our provider about getting a training together that's just about generally what it means to be a subrecipient and how to be a subrecipient of these funds, and particularly on the intake support. yes, we are going to be giving detailed training for you all on the nuances of the application portal, how to use the system of record. By use, I mean access the system of record and view folks' status and see notes so you can communicate with survivors and give them exact detail on where things are, how you would flag or communicate with the program services management vendor when you have additional information. So absolutely, we will be providing a range of technical assistance. I don't know that that's really capacity building per se, Nicole. So if you were thinking about something else, please let me know. And then Jordan, would it work the same way for nonprofits that assist survivors across multiple counties? That's a great question. Honestly, we haven't fully thought that through yet. I don't like just sitting here at this moment. I'm not thinking of any particular barrier or way that working across multiple counties doesn't work with the way that we've structured things or the way that we're thinking about things. I think maybe some of the ways that the survey questions were phrased may have we were assuming and thinking about primarily organizations that were working with folks in one county. So when you answer question, when you're answering questions about number of survivors served, it'd probably be helpful for us in some of those more narrative sections to make very clear to us that you're talking about multiple counties. But it's a really good question. Well, we do have this time scheduled for another half an hour, although I don't want, if we leave it open, I sort of feel like it's not fair to you all. So why don't I do this? Why don't I say we'll hang out for another 5 minutes in case there are more questions, but then we'll shut it down at 4:05. So we'll stay here if there are other things occur to you, and otherwise you can expect written follow-up communication from us this week with some more information. Thanks for being here. Thanks for your interest. Thanks for all the work you've already been doing to help survivors. Jamie, thanks for joining us.
Thanks, everybody.
So Alex, I do have a, back to the cost of building on the McKenzie as we're going forward. I've been texting with one of the contractors upriver and just trying to get a really good grasp on that. What would you like to see from us? Would you like me to find 3 or 4 reputable companies that are up there and just have something written up that you can see what the square footage? Because in Oregon, the average price is $135 to $175, but in the Eugene, Springfield, and McKenzie area, it's $250 to $300 a square. I can't.
Muted. So Devin, that's not what we see when we've been looking at RS means, and there's also I can't remember, there's another system. When we look, and we've been looking by construction market, and that's not showing a significant difference in the Eugene market. And like, frankly, I don't know why it would be, right? I mean, like, why would it be that much more expensive to build a half an hour outside of Eugene than it is to build a half an hour outside of Salem. So I think whatever those folks are comfortable in sharing, whether it's, narrative or numbers, I think that would be a great way to start. And then if we're not understanding, I think we'd be happy to meet with folks. Jose, your comment, I mean, clearly $400 a square foot is higher end finishes. I mean, I don't think anybody's questioning that. And we're not going to fund that. But there is we're aware of reasonable differentials due to transportation. We don't think that they're enormous, but there may be something we're missing. There may, and we're open to that possibility.
No, and I appreciate what Jose said, and it's not higher end builds where these numbers are coming from. This is just what we're getting flat across the board in the McKenzie Valley. We haven't seen anything below 200 a square just for, your basic starter home. So, definitely I want to do more research in this, and whatever information we can find, share it with you. And I'm glad you're open to that. But it's just a concern of mine going forward.
Yeah, absolutely. And just actually, Devin, probably what makes sense even before you make those calls is let me connect you and Jim Taylor on our team. So he's on Lauren Dressen's team. I don't know if you've met Lauren yet, but he's a relatively new hire for us. He's got construction background. His brother is a residential contractor. And he's the one that we're turning to and looking to help us look at this question. So why don't we get the two of you all together ASAP, and then he's probably better to give you advice on what would be most useful for us to see.
That's perfect. Thank you, Alex, for doing that.
Yeah.
I would appreciate talking with him.
Yeah, right on. Cool. All right, it's 4:05. Thank you all. I'm going to shut it down. Look forward to further conversations.